Yeah. So, welcome to Who Cares podcast. This is the most random conversation ever. So Andy's popped in to see us today, and I've just collared him and dropped him in straight into a podcast, completely untapped, completely unthought about. But Andy works at somewhere that's really close to a lot of our hearts in social care, and they do some fantastic work. And I really wanted to give him the opportunity. Just talk about it. So, do you want to introduce yourself, Andy, and where you work and what you actually do?
Yeah, thanks, John. Thanks for inviting me on. So I'm Andy Hood. I work for a charity called West Bank Community Health and Care, and I lead our services for unpaid carers. So we work primarily in Devon, and we run a service called Devon Cares and Devon Young Carers. We're supporting carers who are either in families, friends, neighbours, looking after somebody who needs support.
Yeah, and I think that's the real tricky bit here, isn't it? Because terminology is really important, isn't it? Because when I think about carers, I think about domiciliary care staff, or people that work in care homes, or etc. But we're really talking with you around family members and close people, aren't we? That aren't necessarily paid by the traditional means, like a company, who do this out of love and responsibility to their families.
Yeah, like you said, there's a lot of confusion around the term carer. I think the pandemic had a little bit to do with that, with all the clap for carers going on every Thursday, which is absolutely brilliant and a great thing to do, but it made the term carer a little bit confusing, didn't it?
It absolutely did, and I sometimes sit in meetings and we talk about carers and I go, are we talking left or right? What are we talking about here? Yeah. But it's really important, I mean, and what we do know is family carers and the carers that you look after, I mean, they save the UK economy billions, don't they, by just being a family member and doing what's right?
Absolutely, yeah. So across the UK, there's about 5 million unpaid carers.
That's astonishing, isn't it?
And that's the ones who've identified themselves as that in the census. One of the things we see all the time is actually that people don't realise that they're a carer. They think they're being a good husband or a good wife or a good son, a good parent.
So they've sort of naturally sort of merged into just doing this caring role. And we see really young children as well, don't we, who unfortunately miss out on so much by just being the carer.
Absolutely, yeah. We work with children as young as 4 who are taking on caring roles.
That's heartbreaking, isn't it?
You know, obviously, what a 4-year-old does and what a 40-year-old does are going to be quite different. But the impact on children that age of caring is just huge and immense. It's all those missed out opportunities that we all take for granted when we think of a typical kind of childhood. And more and more often, we're seeing that it just has such long-term impacts on children that they then become more likely to end up in poverty, unemployment, poor mental health, just because of the fact that they're caring for somebody and being.
Well, really I guess I mean obviously we're talking really ad hoc here, aren't we? I guess the fact that they're missing out on so much, aren't they? So much interaction outside of the family. And if you've got to go to school, but before school you've got to get up and you've got to help one of your parents wash, dress, breakfast, and get yourself ready. And then you come home from school, same again, and you're not seeing your friends. You know, you may be late for school because you're running around. That has a knock-on impact. It goes on forever, doesn't it, this sort of stuff? And it's not about, I'm not saying that for anybody that's listening to put a guilt trip on, that's the reality. I think it's very commendable, and you know, hats off to these children. But let's hope there's some support there for them as well. And I think you guys, like you say, you work with these kids too, don't you? So it's
yeah, absolutely. We support young carers of any age. Our commissioning is to support those who've got kind of the more intensive caring roles, where there's kind of a bigger impact on them. But we do a lot of work to support other organisations when they identify young carers, to be able to support them where they are. So that's particularly kind of schools, youth clubs, and those kind of organisations where actually if we can make a change in the system there, it's going to make things better for young carers.
I think that's a really good point, isn't it? It's about spreading the understanding, isn't it, and the impact of that. I think schools are probably getting much better than what they probably used to be.
Absolutely.
And I think
Yeah.
in society, we are starting to become more understanding. But one of the things I really wanted to sort of dig into and dive into a little bit is, as you know, I very much care about social care, and I really like working those collaborative approaches and all those sort of things. What are we missing from social care that could really help unpaid carers? Because there's a whole plethora of things that we have as our gift that we could help with, isn't there? What would really help? Because we've spoken many times about the misunderstandings and stuff like that. What would be if I said to you today, what would be the top 3 wishes? What would they be? I love putting them on the spot, by the way. You have no chance to think about this.
Okay, so top 3 things that would kind of help unpaid carers from social care. So I think the first one, is about kind of recognising what they're doing, giving them the recognition of actually unpaid carers are putting in hours and hours of care. And like you said, they save the economy across the UK billions a year.
Billions, yeah.
I think in Devon, where we work, it comes up to, I think it's just over 2.3 billion a year, which is as big as the NHS budget for Devon.
And that's ridiculous, and that's in deficit. So imagine if they weren't there.
Yeah, and those numbers kind of parallel across the UK. So when you get up there, you're talking 160 plus billion a year saved.
Wow, I mean that is huge, isn't it?
Which, I can't even imagine that much money.
No,
it's a mythical number to me.
Bring Elon Musk on; he can pay it.
Yeah. Yeah, so I think kind of recognition for what they're actually doing is a really big one.
And what would that look like? What do you think that would look like?
Yeah, so some of the things we hear when we're talking to unpaid carers is things like they might get asked to help with double-handed care when a care worker comes in. And that might be coming from the commissioning from the local authority. And there's just all sorts of issues that contains, both for the provider and for the unpaid carer. So I think in those contexts, it's recognising actually that these unpaid carers aren't trained, they're not insured, they haven't got all of that protection, and all of that resource to fall back on. I know it's funny to talk about resource in social care because what resources are there? But I think it's recognising how much they're doing for what little they've got to work with.
Yeah. And quite often I expect, so we've had issues in the past around that exact thing, and I'll talk about that in a moment. But I think also the point of having a care package, POC, package of care, come in is to give you a rest, is to help, and is to give you time to go, do you know what, I just need to be me for 5 minutes, have a cup of tea, put my feet up and have a cup of tea, a couple of biscuits, whatever. So we need to think that through a bit more as well, don't we, society? Is that reasonable? Because I know quite often family members say, it's right, I'll help.
Yeah.
And genuinely they mean it.
Yeah, and they're really wanting to help the person that they care for. It's just like you feel on a couple of things there that are really key. One is actually they need a break. Actually, they might not be physically doing caring tasks 24/7, but they are there watching for it, waiting for it, thinking about it, having that anxiety over what's happening for that person.
Yeah.
And that's all day, every day.
24/7. And I think, as a parent, I can get that from the other side. When my 6-year-old or my 2-year-old has a bad day, at the end of it, I'm mentally done. I'm mentally done. All day long, I'm going, okay, how do I manage this? And that's a very similar situation. So if you're trying to think, how does it feel? I guess, to me, that's how I'd explain it. Yeah. That constant battering mentally, where they might not be screaming and shouting like a child is, but it's constantly thinking about what next, isn't it?
And the difference is, because there's a lot of similarities with parenting, but in most cases, with parenting, the person you're caring for, your child, gets more and more independent. Yeah. Whereas when you're caring possibly for an adult or a disabled child or whoever, the chances are their independence is going to get worse rather than better. So you're seeing the burden on you get greater and greater.
Yeah. And that's where the boundaries have to be drawn, isn't it? Where you say, well, I'm really happy to be that loved one to help, but I do need some help. And that help, I need to have a break, even if it is just to sit in the garden.
Yeah.
And that's it.
Yeah.
So that's number one. Number two.
Number two, so I think is actually making things clear.
Go back to the POC.
Yeah, absolutely. This is the one we come across time and time again. We'll get somebody will ring us up and go, "I've been told I need a POC. What's that?"
Yeah.
Okay, so we'll try and explain. Okay, yeah, it's a package of care. So, oh, what's that? Okay, well, it's where the local authority have decided that they're going to fund a care organisation to come in and provide some care in your home for them or something like that.
Yeah.
And that's always met with a, well, what does that mean?
Yeah. Who's going to pay for that?
Yeah. and there's so much emotion attached around all of that, because for unpaid carers there's lots of feelings of kind of guilt, like are they not enough for the person they care for? Why do I need a package of care? Is it not enough? Am I not doing enough?
Sometimes exhausted.
Yeah, absolutely. And I see it I go into meetings with councils, with other providers, with the NHS, and people are talking and talking and talking. You know, I have no idea what half of these words mean. And I'm sure most of the people around the room don't, but they're not bold enough to say it.
Well, I am a nightmare, because I will call and I go, do you know what? I don't know what that means. And then quite often I heard loads of times where the person who said the abbreviation will say, I'm not quite sure what the words are, but it means this. Because you're so used to just using abbreviations these days. But I think it's really important. That's a really key message, isn't it? From social care, for social care to family carers, be really clear.
Yeah.
Talk to them as if they really don't know. And do you know what? If they do know, it's fine.
They'll still appreciate the candour of it, because I think it's, like the question is, like, who's going to pay for it? That's such a complicated thing to work out in a lot of
who
cases.
Pays? Yeah.
And it's not a straightforward answer. But if we're going, well, it might be the local authority, it might be, it's like, well, how much have I got to pay? How much?
Yeah. I think in that situation, if you're an agency like ours, it's very much along the lines, it will be fine. Let's just wait for the financial assessment to be done, and then let's look at it with you and have that conversation. There's no point waiting and talk about it now, because we just don't know. And be really quite clear about it. Because sometimes we have a conversation as well, if you've got this amount of savings, this could happen. If you've got that amount of savings, this could happen. The reality is, we don't know, do we? We're not the person making the assessment or making the rules.
And often the carer is going to need to go and actually work out, what have I got? What savings have I got? What savings has the cared for person got?
Yeah.
In some cases, that's really clear. In other cases, it gets more complicated, particularly when you get into the realms of kind of part funding from the local authority and part funding from the individual. It's kind of actually, which threshold are you over? Which one are you under? What does that even mean?
And it can change. I mean, it does change, doesn't it? I, as you know, I very recently had my father pass away, and when they did his assessment, he was over in the joint account, but they did split it. When it's half for mum, it's half for dad. But of course, when he passed, it's now all turned to my mum. So now it's like, now what?
Yes.
And it's one of those scenarios, isn't it? So it's a tricky one, but I think if you can just be really clear, don't give out any false hopes.
Yeah.
It's better to say, let's wait and see, than give them out some wrong information, isn't it?
Yeah.
And to go from there, really.
Yeah, and if you can, give an idea of how long we need to wait or what we're waiting for.
Yeah.
Because it's really easy to go, let's just need to wait a little bit and see what happens. But is it, we're waiting to see what happens with their condition? They've got that appointment coming up. Let's see what the result is from that. Or is it, let's wait for the financial assessment. That's going to be, it'll take a few weeks to get your appointment, and then it will take a couple of weeks after that to get the answer back. I know I'm being optimistic with a couple of weeks, but
do you know what I have to say? I mean, in a big shout out to Berkshire, and this is for Berkshire, the Berkshire Council and the team, their health team, were brilliant with my dad. They were brilliant. In days, I mean literally days, boom, 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 everything was done. Bed was in, oxygen was in, assessments done, help was there, CHC funding was being sorted out. And yet in Devon, we know that can be quite the opposite. And it is sometimes a postcode lottery, unfortunately, isn't it?
It is. It is a bit. You know, I think local authorities have got a real hard job to do.
Oh, I'm absolutely pro local authorities because they get really frowned upon, but their hands are tied in every which way.
Yeah, and they've got just as many issues with funding as we have.
Yeah, and it's not just about care for them, is it? They've got roads, they've got everything you can imagine to deal with, and they get a pot of money and say, right, off you go and fix that lot. And then you get providers going, we want more, and carers going, we want more. And they're sat in the middle holding their heads, bless their hearts. So we've got acknowledgement and thinking through the carer. We've got stop the jargon, let's just talk straight to people. And what's the third one?
So my third one is about helping them to take a break and look after themselves.
Yeah, well-being.
Yeah, because like you mentioned kind of similarities with parenting. As a parent, I've got three children, and I'm always putting them.
Sorry, you've got to do this. Just put them off.
And you always put them ahead of yourself, don't you?
You do,
So you go, okay, well, I won't go and do that. Whatever hobby it is that I might want to go and do, I'm going to go and take them to their swimming lesson or their sports club
And that's right, isn't it? Because you go to go out the door and they give you the big bottom lip. Do you know what? I'll just stay.
Yeah, exactly. Yeah. And then when you're an unpaid carer, you put off all those things and more because you're putting so much effort into getting medical appointments, getting hospital appointments, getting to see social care, other professionals, all these admin tasks that come up. And then when it comes to doing those things for your own health, you're exhausted and you put it off.
I think I'll go a bit further than that, though. I think from a social care provider point of view, and I've seen it many times over the years, if you've got a family member who comes in and they are raw with you, they're stroppy, they're argumentative, they're challenging, take a step back. Don't just argue with them. Don't just cancel their care package. Don't send them off with a tail between your legs.
Yeah.
Take a moment with them and say, I understand it's difficult. I understand it's hard. I'm here to help you. Let's talk about this. Let's not fall out.
Absolutely.
And quite often when we've done that, we've become really good friends with them. And they back down and go, I'm so sorry. And sometimes just burst into tears because they are really uptight, some of these people, aren't they?
And the vast majority of the time, those kind of things happen because that kind of family member has been driven to it. They are fighting left, right, and centre to get what they need for the person they care for, hitting barriers all the time. Or it's another form to fill in. It's another person to talk to. It's another waiting 45 minutes on hold to get through to somebody. Yeah. And then finally there's somebody in front of them who might know the answer and they're desperate to get it. And, we're all humans at the end of the day, don't we? And we all have that fight or flight response when we're stressed, when we're exhausted, and that's just what's coming out. But like I say, if you take that step back and just go,
what are they living with at the moment?
Yeah.
What's their situation? And actually, it's a big thing. So, with domiciliary care, it's rife with times being moved and things. It's not because as care agencies we want to. The reality is things happen on the road. We're doing multiple people a day, multiple visits a day. We have cars breaking down. We have people going sick. We have clients who become unwell and we have to deal with it. All that sometimes knocks on to the next client. Yeah. And if you're sat at home as a carer and your loved one, it might be that they need their medication, they might be soiled, it might be they're just uncomfortable, and that time's ticking away. You're becoming more and more stressed, more and more anxiety. So it's no doubt that it can explode. And even if we phone ahead, you still might get a reaction. But I think it's for us as providers to think that through, isn't it? We're not just there as a care company looking after said client. We also need to think about the family as well and say, actually, what's the impact on you? Got people coming downstairs.
And like I said, it's about that clarity as well. And like, actually, if you're able to phone ahead and just be honest, because it's really easy just to go, really sorry we're going to be late, and end the call. But if you can get actually, really sorry, so-and-so's called in sick today, we're getting somebody to you as soon as possible. Or, there's really bad traffic, we've got kind of vehicle issues. People appreciate that, just the honesty, and I think in a lot of cases that would prevent any kind of frustration coming out later.
Yeah, I think that's a really key bit of advice, and we all know to do that. But sometimes it doesn't happen. It's just so busy.
Particularly, when you're dealing with all of those issues and you've got a long list of people to call to go, well, I need to tell them why it's going to be late. You're probably dreading that task because you know that actually you're going to be making people unhappy.
Especially if you've had a perfect storm where the day before you've had the breakdown, the next day someone's sick, and then the third day someone's like, oh God, you've got to have that third call in that week, and that can happen. Unfortunately, we're dealing with hundreds and hundreds of people, hundreds of different bits every day. So I think that's it. So communication, respect, and acknowledgement here, isn't it?
Yeah.
One of the things that we spoke about before, and you hit on it really, really well earlier in the first bit around acknowledgement, around the double-handed care bit, and saying these individuals who are family carers, they don't have the resources, they don't have the training, they don't have the insurance, they don't have all these sort of things. And from a provider's point of view, we also feel that. So when we're asked to do a double-handed care package, we go, the liability will always sit with us. Yeah. And this person isn't trained. So if this person drops their family member, it's us who end up in safeguarding. I'll come on to safeguarding in a minute as well. So is there a space, do we feel, that would be really helpful if, say, Unicare, which I own with Bridget, is doing some move and handling training, should we be given that opportunity out? We're doing a session anyway. Would you like to come along, Andy, and have your move and handling training? Is it something that simple that we could do? Or is it more specific than that, where actually everyone is so different? I mean, because we train very broad move and handling because we have so much we have to deal with. I'm just wondering what we could do. I mean, what would that be helpful? Something like that.
I think in some cases it would be, and some cases it might not be.
Yeah.
Because I think often those kind of training courses are quite generic.
Yeah.
And depending on the unpaid carer, it might just be a bit too kind of vague for their situation.
Yeah.
Some would absolutely love it and deal with it great. So I think if you've got that relationship with family members, and you can see that actually they would benefit from it, by all means offer it, because they could say no, they could say yes.
Well, I was sort of thinking about a more broader approach. I was just thought, if you see all these apps and things, don't you, where you can log in and you can say, I want to have that session, I want to take that session. I just wondered if there was something like that out there where providers could log in and say, I have these training sessions, I have 2 spaces free, anyone's welcome to come. This is content if you want to come and join us. Come for a coffee, have a chat, be part of something. I don't know, I'm just sort of thinking ad hoc really as we're talking about a way that we can support family carers as a sector, because if we can improve the relationships with family members, it does several things, doesn't it? One, it improves the quality of care for the person, makes it safer. It also builds a reputation for social care to be a caring environment and not just good old social care. And 3, it makes a better resilience for the whole of the sector, doesn't it? Because you're working as a team.
Yeah, absolutely. And it's going to be more cost effective in the long run as well to get, really down to kind of nitty gritty stuff. It's, if we're supporting that whole household, that whole kind of caring bubble, as it were, then it's going to last longer. It's going to be more sustainable. Like I say, the person being cared for is going to get better quality of care from all around. And it probably means that person can actually be independent at home a lot longer. And that's got to be a good thing, hasn't it?
I think so. On that note, should we call it a day?
I think so.
Oh, no, I can't call it a day. I'll tell you for why. One thing I did want to bring up with you, and it's around terminology. Some time back now, we were dealing with a family, and they were the most wonderful people. And they were. And the family inadvertently were doing things wrong and ended up getting a safeguarding meeting. and they were terrified.
Yeah.
Why are we using that kind of terminology? It's very corporate. We're going to have a safeguarding lead come and see you. They felt like they were really in trouble, really done something wrong, not supported. In fact, they were terrified. Yeah. That sort of terminology shouldn't be used with families. What do you think about that? I don't think it should be, or am I wrong in that approach?
It's tricky, isn't it? Because part of my role, I'm safeguarding lead for our organisation.
Yeah.
So I deal with a lot of safeguarding, and even among professionals, there's a lot of confusion about what is covered by safeguarding.
Yeah.
So, safeguarding is a really, really kind of specific part of the Care Act and a few other bits of legislation. Yeah. It's very much about somebody is at risk or experiencing abuse or neglect, and they have care support needs that mean that they can't look after themselves. So it is really, really specific. But we often use the term safeguarding to talk about other kind of safety things, and go, actually, somebody's, doing, manually handling somebody and moving them, and they haven't had the training. It's not been part of the agreed kind of care plan, and go, actually, yes, you're putting that person at risk, but are you abusing them? Yeah, you're putting yourself at risk as well. Yeah, and maybe yes, maybe no. It depends on the situation. But the term safeguarding, I think, often gets used like a threat sometimes.
I think that's how they found, and as a social care provider, we sometimes feel that, and we sometimes will have situations where a carer might phone 111, and if they don't stay and do what they say, we're going to raise a safeguard against you, and the carer then gets terrified, and it is a threat. It shouldn't be, because it then dilutes the effectiveness of safeguarding itself.
Absolutely. And also, just because somebody's raised a safeguarding doesn't mean anything's going to happen.
It doesn't. But quite often for companies like ours, it's just a lot of rigmarole and a lot of hassle for no real reason, because you have a couple of phone calls, it all gets go, well, that's nonsense, the phone goes down. But I think, specifically for family carers, I just think we need to be very careful about how we approach these things and be mindful of what you said. It's a very small part of the Act and it's very specific. Yeah. Be very mindful of, are you actually going for safeguarding or are you going for safety?
Yeah, and it's about the whole overall principles of the Care Act is actually we're trying to support people, look after their health and well-being. We're trying to be caring.
Yeah.
We're not trying to be threatening. We're not trying to be the big bad wolf that comes and takes people away. No. And it's, I think, about having that conversation of going, actually, we want to try and support you. We can see that you're struggling, or we can see that some things aren't quite right. Something's not quite going to the plan. Yeah. Can we come alongside you and help you?
So I think there's something also then, isn't there, around education of the family members at the beginning of this journey. Yeah. This is what these things mean.
Yeah.
So if you ever get this phone call that you're going to safeguarding, it may not mean that. It could mean A, B, C, and D. Yeah. So, because the family that I'm referring to, they really didn't understand. They were like, hands up, oh my gosh, I'm going to go to jail, I'm getting safeguarded.
Yeah. And you hear all the horror stories in the news, don't you, where it will say a carer did something horrible and it more times than not comes out to be something completely different that actually happens. Yeah. I think it's very rare for us to get people who are deliberately trying to abuse somebody. Yeah. I think that is pretty rare. And most of the safeguarding I deal with is, it comes down to a misunderstanding about the support, or not quite the right kind of support being put in the first place. And it just needs an open and honest conversation to get, right, what can we do better for this person?
Yeah, absolutely. And we also have to acknowledge that people are human, people make mistakes. Yeah. It's very rare, like you say, that it's malicious. Sometimes it can be, I'm just in a hurry and I'm going to whiz through my day, and things will happen. And it's nothing more than that. And that's not right. Yeah. But that's the reality of living and being a human.
The same thing for my staff, your staff, and unpaid carers in families. It's, somebody calls in sick and you've suddenly got an extra 3 or 4 visits to do in a day, or might have got an extra 3 or 4 assessments to do, and it's like, okay, they haven't got as much time to do it. It's more likely to make mistakes, and it's actually just, again, taking a step back and just going, right, have I done everything I need to do?
Yeah. But I think there's
I've
also a
supported
place,
it.
isn't there, that if you have somebody you're looking after and you do get into a sticky situation with this sort of stuff, do reach out to people and have a conversation. Say, I feel really uneasy about this. And you could even phone a care agency and say, look, I'm a family carer. Could you just talk to me for a minute? Most care agencies should take that moment with you, regardless if you're a client or not. I certainly would. If somebody phoned here and said, I'm really unsure, I would take 5 minutes with them. So anyway, on that note, we are going to finish. Thank you, mate. Thank you.
Thanks, John.
Cheers.